Welcome everybody to the October 16th, 2023 Health and Human Services Committee meeting. Let us dive right in. Do we have any changes to the agenda? No? Okay, very good. Public comment. I don't see anyone and nobody has contacted us in advance. Okay. I do not have a chair's report today. Look at this, we're just flying through the agenda. So we are going to jump right into number 5 on the agenda, which is a report and discussion about the proposed New York State Medical Aid in Dying Act. I'm going to say a few things before we start. One is that this is a proposed law, a bill that's in Albany. It is co-sponsored by both our state representatives, both by New York State Senator Leo Webb and by State Assembly Member Anna Kellis. And I do see someone here from Anna Kellis's office. Carol, do you want to introduce yourself?
Good morning, everyone. I'm Carol Costell-Corbin, Deputy Chief of Staff for Assembly Member Kellis.
Thank you so much for joining us here today. At any point, if you want to jump in and comment or whatever, feel free. Okay?
Thank you.
Thank you. So this proposed legislation has been passed in a similar form or another in 10 other states, most recently in the state of New Jersey last year. And I thought about different ways to try to get us all on the same page, and so I think you'll agree with me. This is not something I normally do, but I'm just going to read something that I already sent out. So in the agenda packet is the text of the actual New York State bill. I'm not going to read that because that is long and dense. But then I also included a summary which was made by an organization called Compassion and Choices. They are an advocacy group, a not-for-profit advocacy group for this kind of legislation. And I'm just going to read their summary because I think that's the easiest way to get us all on the same page. It only takes about 4 minutes. So here we go. This legislation allows a terminally ill, mentally capable adult with a prognosis of 6 months or less to live to have the option to request, obtain, and decide to ingest medication to die peacefully in their sleep if suffering is unbearable. The bill is modeled after the Oregon Death with Dignity Act, which has been in effect for 25 years without a single instance of abuse or coercion. Eligibility criteria. Just like the Oregon Death with Dignity Act, to be eligible, a person must be an adult, age 18 or older, have a medically confirmed terminal illness that is incurable and irreversible and will likely cause death within 6 months. Be mentally capable of making an informed healthcare decision. Individuals are not eligible for medical aid in dying because of age or disability. Core safeguards and regulatory requirements. 2 physicians must confirm that the person is terminally ill with a prognosis of 6 months or less to live, is making an informed healthcare decision, and is not being coerced. The attending physician must inform the requesting individual about all of their end-of-life care options, including palliative care and hospice care. There is a mandatory mental health evaluation if either physician has concerns about the person's mental capacity to make their own healthcare decisions. The mental health provider must confirm in writing the dying person's capacity before a prescription can be written. The individual must make a verbal request for the medication and a written request witnessed by 2 people. The terminally ill person can withdraw their request for aid in dying medication, not take the medication once they have it, or otherwise change their mind at any point in time. The individual must be able to self-ingest the medication. In other words, they have to physically be able to take the pill themselves. No physician, health provider, or pharmacist is required to participate in medical aid in dying. Prescribing providers who comply with all aspects of the law receive civil and criminal immunity. Anyone attempting to coerce a patient will face criminal prosecution. Unused medication must be disposed of as required by state and federal laws. Health insurance benefits are unaffected by the availability of medical aid in dying, and life insurance payments can't be denied to the families of people who use the law. The New York State Health Commissioner is required to issue a publicly available annual report about the usage of the law. Patient and physician identifying information is kept confidential. So that's a summary of the law. I really feel like it covers so many bases, which is why I just wanted to read it. I think it answers a lot of questions right up front. So having said that, having read it, I want to open it up for discussion, questions, comments. Start there. Susan.
I'm trying to remember the exact year, but it was at least 8 years ago, when I was the director of the library, we had a special presentation with a doctor from Oregon to come and talk about this. And it was the only time the library was ever cited for going over the capacity of the public meeting room by a significant amount, because the room was so crowded and there was so much interest in this and so much support for this. And I think this would be really welcome in our state.
Good. Thank you, Susan. Amanda.
Yeah, thanks for bringing this up, Dan. I think it's essential, and I think if someone is at this point in their life where they are suffering so much that they can reasonably make this decision, I think that that's should be a choice that they can make. Probably a year ago now, I heard a episode of This American Life. I think it was This American Life. And it was, I don't remember all the details, it was a while ago, but it was about a couple who, one of the partners was, severely ill, and it chronicled all the things that they had to go through like this is what they wanted to have happen, but there was just so many restrictions, and I don't know what state they lived in anyway, but they ended up in Europe, in some other country, because they were able to get to be a part of this process there. And, all the expense and the travel and, traveling to another country with your ailing husband, and then having to figure out what do you do with his remains when you come back. So sure there are ways for people to do it, but I think that having a state law that allows it to happen here, I would be supportive of that. And this to me seems reasonable. Obviously I'm certainly not an expert in the area, but I think compassion is the key word here. So.
Thank you. Randy.
It's definitely better than Dr. Kevorkian, right?
Say it again?
Definitely better than Dr. Kevorkian? Was that the gentleman who...
Yes, I don't know exactly what his techniques were or whatever, but...
Yeah, and it was kind of underground.
I guess, yeah.
That's what they were doing then. I think this is appropriate. I actually did watch a documentary on the Oregon law, and they went through 2 patients that had gone through the whole process, and it was, very interesting, and I can imagine, at some point it's just not worth it anymore. So I understand.
Susan.
Well, I just wanted to reference, I looked it up very quickly. It was an article in the New York Times in 2015 where Professor Sandra Bem from Cornell was a very prominent professor. It's an article about how she decided to take her own life because she had Alzheimer's, and it was it was getting towards the time when she knew she would lose her cognizance. I can send you the article. It's really good. And she did this at a time when, of course, it was illegal, but it was a really moving article. So
I'd be interested in seeing that. Thank you. And I do recognize the name, but I had kind of long forgotten about that person. Any other questions or comments? Well, I'm going to say something that, yeah, I definitely support this law. I will acknowledge that there is a group of people, there are a couple of groups that are generally opposed to this law, and one of them is broadly defined as the disabilities community. And I did reach out to Jan Lynch at the Finger Lakes Independence Center to let her know that I was thinking about doing this and just wanted to hear her thoughts. And she said, yes, the disability community is in general very opposed to this. And she sent me a bunch of information about why. And I read through that, and I personally didn't change my opinion on this. But I just wanted to let everyone know that there is like a group of people who, you know, I think we all care a lot about and want to, you know, help with their lives too, that don't like this law. So if we continue to talk about this, if we take any other action, we may run into we may start hearing about some people that don't like this law. Amanda.
Well, so you included the text of this. Is this the only one that's on, like, sometimes there's two versions or something in the
I'm not aware of another version. Carol, are you able to respond to that?
I could pull up, see if we can find the actual memo of the text, but I think what you shared, Dan, is accurate in the sense that all of the pieces about being able to make that decision, to be in the capacity to make that decision for yourself, is part of it. And there is, let me just pull this up. You know, if there's ever a concern about a person's judgment, there is language in the bill that the doctor should refer the patient to a psychiatric or psychological evaluation to, you know, have a determination that the patient has clear decision-making capacity. So there are some safeguards in there. As you shared before, the piece of it was never to be subject to age or disability. So really having to have that diagnosis that that you're terminally ill and not likely to live beyond 6 months. So I think there is really some clear kind of guardrails on the law, that it wouldn't just be applied to anybody with a chronic disease or disability, but really has to be terminally ill. I'm not sure if that completely answered it, and I can't kind of sort through the full text right now, but that's really the spirit of what the text is.
That's good. Thank you. I guess we were wondering, are there any other bills in the legislature that deal with this topic, or is this the only one?
This is the only one that I'm aware of, and it has, you know, pretty broad support in the Assembly and the Senate. There are a number of, you know, co-sponsors on it, but currently it has not made it out of the Health Committee in the Assembly.
Thank you.
Does Representative Kellis support this?
Yes. So she is a co-sponsor on the bill. She's been a pretty vocal proponent for it in a number of press conferences and, you know, different venues. So she is, yes, a supporter of the bill.
Also, State Senator Webb is a supporter of the bill. I'm not sure. Well, okay, let's hear from this. Okay, thanks. Just got a note that somebody is zooming in from the public, so we're not sure exactly who. If it's okay with the committee, I'd like to hear from this person. Okay, Abigail, are you able to hear me, and can you unmute yourself and speak to us if you'd like?
Hello, everyone.
Yes,
My
hi.
name is Abigail Melendez. I am the Deputy Legislative Director for Senator Leah Webb.
Excellent.
Yes, and I just wanted to mention, yes, she is a co-sponsor to the bill. She does support the bill. She is aware of the disability community that opposes it, as she also supports the disability community, but to each his own, you know. But she does support the bill in full support. And we have had meetings with Compassion and Choices, you know, the group, and they've been very, you know, vocal about the legislation and bill. And it did not pass the Senate Health Committee, but, you know, it will be taken up again next session. Thank you.
Thank you. Thanks for coming to the meeting. Well, I would also like to mention that as I thought about this topic and what I would like to do about it, I thought we'd just have this meeting just to draw a little attention to it. But B, I decided I'd really prefer not to have a resolution on this one. In general, I often say that I don't think we should spend too much time on resolutions that have to do with New York State things, and certainly beyond that. And there are definitely some exceptions, but what I thought I would like to do instead is to write a letter of support. And that way, any legislator that wants to sign on can, and if they don't want to sign on, no problem. And so let me pause there for a moment, committee members. Does that seem like a decent way to go forward? Okay. Okay, that's great. So I will work on this letter sometime after this meeting. I will touch base again with Assemblymember Kellis's office and Senator Webb's office to see just to make sure that our letter is helpful to their efforts in whatever way. I'll try to keep it short and simple. And I will then circulate it to everybody, and we'll sign on or not and send it off. Anything else on this topic before we finish? Abigail, Carol, anything else you want to say before we sign off on this topic?
No, but thanks for inviting us. And you know, we could touch base with the assembly member, but likely we could forward the letter of support directly to the bill sponsor.
Likewise, I just want to say thank you for also just inviting us. And sorry that our legislative director couldn't make it, Mandy Phelan. But we can also forward it to our. I would forward it to our sponsor and the chair of the committee that it's in.
Great. I'll take a crack at writing it. I'll send it to both of you, to both of your offices, and ask for feedback, and then we'll go from there. Does that sound good?
Sounds good.
Okay, excellent. Thank you very much, everybody.
Thanks.
All right, we're going to move on to the next topic then. The next topic is the County Administrator's Report. We have Bridget Nugent here.
Thanks, Dan. Just one quick administrative update. September 30th marked the end of the last 6-month vesting period 4 for the New York State Healthcare Worker Bonus. So you all will be seeing a resolution accepting funding related to the few employees that continue to be eligible. Following this vesting period, there'll be one more vesting period. So you can anticipate only one more round of this funding coming through. And that's all I have.
Thank you. So those are bonuses for healthcare workers as a thank you from the governor.
Yes.
Does that sound about right?
Yes, that's correct.
State money.
State money, yes.
Okay. Do you have any sense of how many of our employees have already gotten this, a rough number?
I can quickly look that up and let you know. Yep.
I think it might be interesting and helpful.
Absolutely, sure.
Thank you. All right, any questions for Bridget? All right, we are moving on to the Department of Social Services. I see Kit Kephart is here. Hello, Kit.
Hi, Dan.
Hello. We have 3 resolutions from you, with you. The first one is Budget Adjustment, Grant Acceptance, Department of Social Services, Child Passenger Safety Grant. Does somebody want to move that? Travis moves, Amanda seconds. Thank you. Kit, do you want to say anything about this?
Sure. So we are really excited. Staff did a lot of work to bring this forward, to apply for this. We're really excited that we've been granted this. It's a relatively small grant, but it's going to. We have a couple of staff that are trained to install and teach people how to install car seats. So they train all of our staff for transports and making sure that people know how to use them. They help with foster parents to know how to use car seats safely. But in addition, we also offer that to the public and to try to buy car seats to help people that are low income that might not otherwise be able to buy an up-to-date car seat. So we're really excited to get this funding, and I think it's going to be helpful certainly to us at DSS as well as the community.
More money, more training. It sounds good. Any discussion on this resolution? Okay, let's have a vote then. All in favor? That is unanimous. Thank you, everybody. Next up is the resolution amending resolution number 2023-181, mid-year budget adjustments, social services. Will somebody move that, please? Travis moves, Susan seconds. Kit, does this one need an explanation?
So, these next two resolutions are really resolutions that you saw me talk about last month. Really, the reason that they're coming to you again is because we did not pick up on a couple of errors on each one of them, so we're just correcting those. This is really just consolidating most of the federal and state revenues in our 60-10 programs, and so this is just kind of moving money in places that it's needed. Are within some of our mandate areas. So our safety net is significantly higher than what we anticipated. So we're just moving things around. There's about a $500 error in each of these resolutions, and that's why we're bringing them again, is to correct that and to have them reapproved.
Good, thank you. Any discussion on this resolution? Let's have a vote then. All in favor? That is unanimous. Thank you, everybody. The next resolution is amending resolution number 2023-183, budget adjustment, social services, administrative revenue account consolidation. Can I have a mover on that one, please? We've got Susan moving and Travis seconding. And Kit, I think you've already explained this one too. That's the same. I think you did both. So any other discussion about this resolution? Let's have a vote then. All in favor? That is unanimous. Thank you, everybody. Kit, is there more that you would like to tell us about your goings-on?
Just some quick shelter update. I'll let people know we've got, I think it's 83 people in shelter at this point. We have not started our code blue, 83 individuals being sheltered, 68 adults and 15 children. We have not started our code blue season yet. We've been fortunate not to have anything that has dropped down to 32 or lower, but we are already at 83 people sheltered, and we are managing that. So just wanted people to kind of have that update. I don't believe we have a lot of training going on right now because we have all of the all-staff end of the year trainings happening at DSS. And those are pretty much the only updates right at the moment.
Kit, would you consider 83 a relatively high number for this point in the season?
I think we've seen that number be as high other years at this time of year, but it certainly is higher than what we have typically not that long ago seen. So the numbers are rising, and I think we're seeing that pretty consistently. That the numbers rise pretty quickly in the fall and give me concern about where we'll go at the peak of the winter season.
Thank you.
It's certainly a concern that we continue to see as many families and as many children in shelter. I think those are it's not so much the overall number as it is the trends of who we're seeing sheltered.
Randy.
Yes, thank you, Kit. How are your staffing levels? Are you finding more people applying and taking the civil service exams? How's that going?
I think we have had good luck with people taking civil service exams. We continue, so, I'm an oldie, so I've worked at DSS for a long time, and I'm coming up, I think, on my 24th year soon. So I've been there for a long time, and my experience has been that we have always seen kind of a slow turnover in our child welfare division. But on our eligibility side, we have historically had a very stable staffing until a couple of years ago, and then we really started seeing transition. I think a lot of that has been precipitated by retirements, but it's also no doubt just the labor changes that are happening. People have opportunities and they're moving. So we are still in the process of hiring. So I think we're seeing a good number of people take civil service tests and be available. Our challenge right now, and I think it's going to be a challenge for some time, is that because we've had such turnover, we really don't have the number of senior social welfare examiners, senior caseworkers, and principal social welfare examiners. We just don't have that experience. We're getting people in the door, and we are continuing to do hiring, but it is really challenging because we don't have the experience. And there are some things within job descriptions that people just can't. We're having to kind of cover and kind of stick things together in a makeshift way because we don't have that experience. So that's challenging. It's going to be challenging for a while until we get another round of people experienced and developed. So it's tougher than it's been for quite some time.
Thank you and good luck.
Thank you.
Other questions or comments for Kit? All right. Well, thank you very much, Kit.
Thank you.
Next up is Department of Whole Health. Frank Krupa. Frank.
Hi
Good
there. Afternoon.
Oops, sorry, I cut you off.
That's okay. Did you want me to speak to the action item?
Yeah, let's get it on the floor first. Yep. So we have a resolution, budget adjustment, supplemental epidemiology and laboratory capacity, ELC, COVID-19 funding, whole health. Somebody want to move that? Amanda moves, Travis seconds. Okay, Frank.
Sure. This is just continued spending of our COVID grant that we received, $1 million in total of. Each time we have expenses, we add the revenue from the grant to the budget. So there's no county cost involved, and this is going to be around a campaign related to vaccinations for COVID.
Good, thank you. Questions or comments for Frank for this resolution? Okay, let's have a vote then. All in favor? That is unanimous. Thank you, everybody. Frank, anything else you want to tell us about whole health?
I don't really have any updates. I'm happy to answer any questions if anyone has any.
Questions, comments? All right. Thank you, Frank.
Thank you.
Next up is Office for the Aging. Hello, Lisa Monroe.
Hi, can you hear me okay? We're
Yes.
way back here.
Way back there. Yep. You're all silhouetted.
Yes.
It looks sunny.
we are.
I know it's not true.
It's not true.
Why don't we do your resolution first, and then we'll do the
Okay.
presentations. Does that sound okay?
Great, yep, sounds good.
Thank you. So we have one resolution, budget adjustment, terminal pay, Tompkins County Office for the Aging, COFA. Does anybody want to move that one? Amanda moves. Susan seconds. Lisa, anything you want to say about this one?
No, it's just as it reads, requesting the reimbursement for the terminal pay for Bob Slocum, who was here at the office for over 30 years. So he had acquired, quite a few hours of benefit time, and we're informed that we're eligible to apply through this from finance. So we decided to do that because it was not in our budget.
Very good. Questions or comments before we vote? Okay, let's have a vote then. All in favor? That is unanimous. Thank you. Okay, let's see. So I'm on the COFA Advisory Board, and I heard this presentation about the new aging in place services that are provided by the office. I thought it was really interesting, and we like hearing about new things, so I asked if it could also be presented here. So, you're on.
Great. I'm going to start a little bit, and Andrea Davis, our outreach worker, is here with me, and she'll take over about halfway through. So I'll share my screen now. Oops. Trying to get to there's so many buttons up here, it's unbelievable.
Yeah, just hit them all. One of them will be right.
Yeah, that's kind of what's happening. Okay, can you see that okay?
Yes.
All right, it's full size, correct?
Yes.
Okay, good. All right, so so we're just here talking about our certified aging in place specialists. We're doing evaluations for aging in place, and I just wanted to give a little context to what that means for people that don't know that. So the CDC definition of aging in place is the ability to live in one's own home and community safely, independently, comfortably, regardless of age, income, and ability level. So on the slide, there's also just an infographic here of a survey that was done in 2022. This is, nationwide, that, we know that nearly 90% of people over 50 desire to age in place in their homes and communities. And again, this was done in 2022. So these numbers have stayed steady, even with COVID, when we've shifted our focus to people that were socially isolated. But people still do want to be in their homes. But you can see in the bottom half of the screen that people aren't really prepared to successfully age in place. A lot of people haven't thought about the considerations that they'd have to make to stay safely in their homes. This slide, recently we were, NYSOFA, the New York State Office for the Aging, conducted a statewide needs assessment for people 60 or older. We had the statewide survey data since the spring. Recently, we were just given access to our local data, and there was about 567 respondents from Tompkins County. And one of the key findings in this survey was that, again, consistent with national data, most people want to age in place. But there's a lot of challenges associated with that, particularly with housing, their physical health, healthcare. 40% of the older residents who completed the survey, indicated a major or a moderate problem in the 12 months prior to the survey. This also is a finding from the survey. And basically it was the section on housing. The survey was broken up under basically with age-friendly concepts and pillars in mind. And the housing section saying, most people do want to age in place, but their homes don't have the features of universal designs. They're not made accessible for walkers or wheelchairs. Or anybody with, experiencing any kind of mobility impairments, and the housing stock, it's not affordable and suitable for older adults as well, some of it. But the livability score out of 100 was only 21, which is low. This is also some of the potential problems that people indicated that, it was the percentages of problematic issues in their homes, people having housing to suit their needs, maintaining their yards, doing heavy, intense work, maintaining your home, period. And also the quality of the housing in the community was, the percent positive was very low. You can see the availability of affordable housing, accessible housing, and a variety of options are definitely rated on the low side. So I wanted to just give you a little context before we go into why we were looking into this. As well, our office provides many different programs that help people age in place, like our directly provided aids, our ISEP program that helps, in-home services for people, our personal emergency response system that we do, Those are all types of things that help people age in place, amongst other things. But we felt this CAP certification and the home safety assessments and evaluations that we do are just one more step that people can, we can do to help people be in the right space to age in place. So I will hand it over to Andrea, who is a certified aging in place specialist, CAPS. Thank you.
Hello, everyone. So what is CAPS? So CAPS refers to Certified Aging in Place Specialist. These professionals use universal design to make housing accessible for everyone. And later in the slideshow, we'll show examples of what universal design looks like. But really the goal is just to make the home easier to use for all abilities. So in order to receive a CAPS designation, participants need to complete 3 7-hour trainings and pass the test after each training. The trainings are facilitated by the National Association of Home Builders. So there's a variety of professionals that can use this designation, from community health partners to physical therapists to contractors. So how can our office help? CAPS specialists at COFA can assist by suggesting modifications to allow older adults to live in and enjoy their home longer. So we can walk through a home with a client to evaluate the changes that may range from minor, such as handrails, to more involved solutions, such as an elevator or a stair lift. We look at various rooms and situations in the home that the client may have a need or concern about. Our office also can perform a no-cost false home safety assessment for the client. So during these home evaluations that we can do, we can provide this other service, and it's at no cost to the client, like I mentioned before. So we mentioned that there's different professionals that can work within their CAPS designation for a client. So CAPS professionals at COFA evaluate the usability of the home, but we are not contractors and we cannot give estimates or exact details like specific placements on grab bars and such, but we can give the client ideas and suggestions and contacts to reach out to. We also can tie that in with false home safety assessments. With CAPS, we focus on making the home usable for all abilities, and with false home safety assessments, we look at what is in the client's home that can put them at risk for a fall. So scatter rugs, dimly lit areas, lack of grab bars in various areas. But of course, there can be some overlap between the two. But it's up to a client's request if they would like to have one or both of these services through our office. So, what is universal design? What does that mean? So universal design allows household products like a stove, cabinets, bathroom appliances to be used safely, easily, and more comfortably. So universal design is user-focused, and when it's done well, universal design becomes a virtually invisible element of the home. So in this, oops, I'm sorry.
Go right ahead. I'm going too fast.
So in this bathroom, this is a universally designed bathroom, and it can be used by people of different abilities. So someone who is standing can use this bathroom with ease, as well as a person that is needs to be seated for a bath, well shower, or needs a wheelchair to be rolled in. So as you see, there's a shower chair that a person can be seated at, and the shower head is on a track, so it can be lowered if someone's seated, and it can be raised up as well, and it's also a handheld one so that it can go wherever the client is in the shower. Also, the toilet seat is raised and has grab bars with it, so if someone does have difficulty getting down or getting back up from the toilet, they can use this toilet with ease. So,
next slide. Yep.
So what universal design can look like in a client's home, here are some other examples. In this picture, the pantry has so that a client does not have to reach in or grab things that may be further in the back and difficult to reach, that are further in the back. So it's pulled out, has full visibility, and the client can access all the items. On the refrigerator, there's larger handles that are easier to grasp for a client who may have trouble using the smaller handles. And then on the countertop space, the client has the ability to either be seated and use that food prep station, or they could be in a wheelchair and still roll under that station. So again, another bathroom just allows a client to be seated or standing to use the bathroom. The soap dispenser or soap bar station is lower so that if a client is seated, they still can access that easily. Another view of the bathroom. For this one, the counters are, one is lower, one is higher for clients that may be seated or standing, and the cabinet space is pushed back under the sink to allow for a wheelchair to roll in and the user to be able to access the sink fully. In this picture here, we have a client that's in a wheelchair, and the control knobs for the oven and stove are at the front of the stove so that the client does not have to reach over a hot stove to turn up and down the heat. And as well, on the side of him, he has a workstation where he can roll under and use with ease. And once again, just the large handles, and as you see a better picture of it, they're easier to grasp for someone who may have difficulty grasping the smaller handles. So why is universal design beneficial for all? So here are several different types of disabilities and universal design. And someone's home focuses on each of these disabilities, or can focus on each of these disabilities. So for mobility, a client can have a wheelchair. A client that does have a wheelchair can have a ramp or a stair lift and a walk-in shower. For cognition and independent living, you just want to have a design that makes all the appliances and the areas easier to use for the client. With hearing, you can add universal design features such as the visible alarm. So when the doorbell is ringing, the kitchen timer is going off, or someone is calling, there's a flashing light. So if they're not able to hear clearly the alarm, they can still see a visible flashing light. With vision, just making things easier to navigate, having less barriers and more contrasting colors so they can see where different services end and begin, and adding additional lighting, of course. And for self-care, designing the home just to make it the individual more able to take care of themselves. So having handrails in the bathroom, built-in shower chairs, stoves that can be used while seating. And this can also be beneficial to visiting friends and family who may have a disability when they're coming to visit another friend or a loved one. So before and after photos of the kitchen. So in this kitchen, you see here to the right, the handles are smaller in this kitchen, as well as for all the cabinets, as well as the refrigerator. And you have your classic style window, which you have to unlock up at the top and push up. And then there is a slight raised threshold that separates the kitchen from the hallway. So in the picture on the left, you do have lights underneath the cabinet so that the client can see where the cabinet begins/ends. There are bigger handles just for the client to use both the refrigerator and the cabinets. There are crank style windows, so it's easier for a client to open the window instead of having to push up the entire window. And the threshold has been removed in the kitchen so that the client can just, if needed, it can just roll right into the kitchen. So in these two pictures here just kind of give you a more in-depth view of the kitchen. So at the bottom you see the pantries pull out. So once again, the client has full visibility and can access all the items in the pantry. And then the top picture, one of those half-moon cabinets, when they open it, they can pull out the drawers to access the pots and pans that may be in a traditional cabinet tucked further away in the back. So, CAPS trained contractors. So there is one local Crown Construction in Dryden. They do have a few professionals, contractors there that are CAPS, that have their CAPS designation. So they are contractors, and you can get a more updated list using the website listed below and searching the directory of professionals with home building designations. So CAPS is what you're looking for, because there's a few different ones out there, and you can search by state or city. So what to expect from our office. So CAPS professionals can perform a no-cost evaluation of all areas of the home at the client's discretion, and we can provide tips and suggestions on how to make the home universal design friendly and or conduct a false home safety assessment. We can give information on who can do these upgrades, as well as information on agencies with rental/purchasable adaptive equipment. So it's very important to empower people with the tools necessary to age in place, and we can help with that. That is our main goal in this office. So listed here is our contact information. Clients can call our office and request to speak to one of us to gather information or to request about an evaluation. So it is myself and my coworker, Amy Jackson, who both have our CAPS designation.
Okay. So I can stop sharing now. Yeah, so that's pretty much it.
Excellent. Thank you so much. Are there questions or comments from committee members? Amanda.
Thanks for this. It's great information. I'm glad to see this is happening. I'm just wondering, how often is your service being requested or used through the Office for the Aging for this?
So we did a presentation at one of our Aging Services Network meetings a month ago. And since that presentation, we've had, I want to say, 4 people that have reached out to have a aging in place evaluation. So since we broadcasted it, it has been requested more frequently.
Great. Yeah.
We have got the information out through different sources too. I think, when did you become certified? You were last year and Amy was just this year. So now we have 2 people. Of course, today is the beginning of Medicare open enrollment. So that's taken Amy away. So even though we're trying to get your information out, we're trying not to get too much at once because staffing capacity is always an issue. But we're happy to do it. And typically, it's not an emergency service. So people can, usually wait a couple of weeks until we have the staff to be able to get out there to do that.
Great, thanks.
Other questions or comments? I have a few. So what are the criteria for who can take advantage of this service? Is there an age limit?
I mean, typically, no, there's not. We serve through our New York Connect program. We can serve anybody over the age of 18. Typically, some of our funding sources are 60 plus, but the way this is funded, we're able to, if somebody requests one and we can do it, we'll do it. We might, if we get a lot of requests, we may prioritize 60 plus, but we haven't gotten there yet.
So for now, if somebody wants the service, they contact you, they make an appointment, you come out and you talk with them, look at their house, give them ideas. Is that?
Yes, that's it in a nutshell.
Okay.
Yep.
I just want to say a couple things. That first of all, I saw this presentation myself a couple weeks ago, and I've been looking at things differently since then. I really have. I've been paying attention to things that like tables and desks and kitchen counters and appliances. If there's not space underneath, like right now, I can stand there and lean over, but I could see why someday that may not be easy to do. So for a wheelchair, but even just a chair, to get a chair under there. Otherwise, you have to like lean over, and again, someday that may not be easy for lots of people.
So true. And I think, the other thing is, typically universal design is best done and most cost effective if it's done during the building phase. But that's not the case in most of our houses. So, when Andrea or Amy go out, they're at least able to give some people some, small, inexpensive ideas for some modifications that they could do that could just help a little. Of course, any kind of retrofitting or modifications on large scale are going to be a little bit more expensive, but there's small things that you can do, I think, that are really helpful for people.
I also want to say that a number of years ago, I heard some presentation kind of like this. I think it was through your office. And somebody said that it turns out that most modifications that can be made to make it easier for people when they get older or disabled turned out to be popular among younger and more able-bodied people. So larger handles on refrigerators and drawers, for example. It turns out everybody likes those things. So I've always kind of kept that in mind as well.
Yeah, absolutely. I mean, we're looking at our door right here. It's got the levers on it, where, a mom with young kids use their elbow to open the door as opposed to just a regular round knob. So yeah, there's things that it's really truly across the lifespan, and it's, to age in place from a young age all the way, it's not just for older people.
Susan.
Yes, about 2 or 3 weeks ago, when I was out walking my dog, neighbors in my district actually stopped to talk to me about aging in place on the street. We have several households, people over 60, myself included. And I'm just wondering, if I go to the Office of the Aging website, can I find this, any information or the contacts? Is it on the website? Because I'd like to send it to them.
You will be able to now, Susan. Okay. We'll get that up.
Okay.
We have our home safety assessment evaluations up because that's an issue that we've been working on for years and years, falls safety and falls prevention, that kind of stuff. So this is just kind of in addition, we're adding this kind of under the big spectrum of aging in place. So yeah, we're going to make it a little bit more robust, and I will make sure that gets on there.
Great, because I think there would be a lot of interest in Ithaca because we have a significant percentage of population over 60. So I think it'll be popular. Thank you. It was a great presentation.
Thank you.
Okay, any last questions or comments? Lisa, Andrea, thank you so much.
You're welcome. Thank you.
And then Lisa, is there anything else you want to say about the Office for the Aging and things that are going on? Did I lose you?
No, I think I mentioned it kind of that, today is our first official day of open enrollment, Medicare open enrollment, so it's a busy time for us. We have 2 aging service specialists that are busy with booked out appointments pretty much until the end of open enrollment, which is December 7th, I think. So it's our main focus right now.
Okay, well, good luck with all that. Thank you.
Thank you.
All right, we're going to move on to departmental updates. We've hit some of them already. Let's do the ones we haven't heard from yet. We have Veteran Services, J.R. Claiborne. Welcome.
All right. Uh-oh. I'm not showing. There we go. Can you hear me?
We can definitely hear you, and now we can see you. You're on.
All right, beam me in. Good afternoon, everyone. Just in a way of updates, I want to share that I was out part of last month for a training, the last week of the month for a training with New York State Division of Veteran Services, and I will be out the last week of this month for a week-long training with the National Association of County Veteran Services of America. I think I'm saying that correctly. On a newer front, I've started hosting a new program of our new VA clinic. It's the Veterans Advisory Clinic, so I'm hosting that here in the building. And the other thing is that I'm going to be working with folks, or continue to work with folks, in preparation for Veterans Week and Operation Greenlight next month.
Thank you. Questions or comments for JR?
Just that I really like your background picture.
Hey, thanks to Joe Scaglione. This is one of his pictures he left me.
He does do nice photography. Okay, well, thank you, JR.
Thank you. Take care, everyone.
You too. So let's see, County Youth Services. I see Teresa Albert here. Are you our person today, Teresa?
I am your person if I get my video.
Okay.
Okay, it's not working. Oh, there we are. Good afternoon. I just want to mention we had our municipal recognition and networking event last week, and it was well attended. We had about 38 people that attended. People were very happy to actually be in person and be able to talk to each other about their municipalities and their unique situations, their challenges, their successes, and to share some ideas and their experiences. We also recognized 7 volunteers that each served 20 plus years in their local planning group, which is incredible that someone stays that long on a committee. So we are very happy. And we also recognized 2 Cooperative Extension Rural Youth Service Program educators who also each served 20 plus years in their position with Cooperative Extension and working in their communities. So it was a great event, and we hope that we can, this was like 3 years in planning because of COVID, so it kept getting pushed off, and we hope that we can do this more frequently so that people can get together and network. But that was our big highlight for the last couple of weeks.
Very good. I know that you invited us all to that event, but we all had a budget meeting that night. I would have gone.
Yes.
Would have happily have gone. Questions or comments for Teresa? All right, I'm going to keep talking about myself then. I was on the Danby Community Council for 7 years. I remember going to this event way back then. And then I went to Cooperative Extension Rural Youth Services, and I hired several of those 20-year people. So it's good to I know 1 or 2 of them are still in it. So
That's great.
I'm done patting myself in the back. Thank you, Teresa. Thanks for coming.
Thank you.
Next up is Ken Clark, Office of Human Rights.
Oh, good afternoon. I don't have a report for today.
You don't? I'm sorry, you don't have a report for today. Is that what you said?
Yes.
Okay, no problem. Questions or comments for Ken? All right, Ken. Thank you for coming to our meeting anyway.
Okay.
Next up, Cindy Wilcox, Human Services Coalition.
Hi, everybody. I have just a quick save the date announcement. HSC and the Continuum of Care Network will be hosting a housing summit on November 28th and 29th. We're going to have, it's like everybody's going to be invited. We have housing providers, business owners, landlords, funders, legislators. We have Nichelle Carver coming as our keynote. She is our regional advisor with the U.S. Interagency Council on Homelessness, which basically is 19 federal agencies that work together to implement the federal strategic plan on preventing homelessness. So she's going to be with us for 2 days. The first day on the 28th is the big summit, which is kind of like symposium style. We're going to have, she's going to be the keynote. We're going to have panelists, breakout sessions, etc. And then day 2, we are planning a series of like private audience stakeholder meetings. So hopefully the legislature will be one of them, or even HHS. Our planning committee is meeting this week to kind of finalize our planning plans. So you'll be seeing more information forthcoming, but we're excited about it. So mark your calendars.
I am literally marking my calendar as you're talking. Questions or comments for Cindy? Cindy, should we expect the first day to be kind of an all-day thing?
Yes, probably. It's going to be at the Hotel Ithaca, the one across from Cultivari. It'll probably be like a 9 to 3 type of situation.
Okay. Very good. Well, thank you very much.
You're welcome.
Next up is advisory board appointments. We have one advisory board appointment, Deborah Barber, to the Community Mental Health Services Board. Is there somebody that can move that? Randy moves, Travis seconds. Discussion? Let's have a vote then. All in favor of this appointment? That is unanimous. Thank you, everybody. And minutes approval from September 18th from our last meeting. Is there somebody that wants to move that? Susan moves, Travis seconds. Discussion about the minutes? Okay, let's have a vote then. All in favor? That is also unanimous. Very good. Comments from committee members, liaison assignment reports. If they have anything for us? All right. The next meeting of this committee is November 20th. We're going to have Melissa Perry from the Child Development Council. She's got some pretty big news for us. I think it might have been released publicly. I don't know if it is or not, but I won't say it right now. If not, you'll hear about it soon. But also that'll be our opportunity to talk any child care issues we want to talk about in the county and how county government relates to it or otherwise. All right, any other business before this committee today?
Dan, I just wanted to quickly respond to your question from earlier. Approximately 95 of our employees have received the bonus since the beginning of the program.
Good number. That's nice.
Mm-hmm.
Okay, anything else? All right, this meeting's adjourned. Thank you, everybody.